talking about bite. So mainly, how do we actually evaluate the bite scanning? Okay, so how do we know that the bite scanning is wrong? How do we know that there's an error during bite scanning? So whenever you're done with the bite scanning, okay, and after refinement, always check the arch from the opposite side. So for example, I'm here checking this arch from the opposite side. And actually these shiny areas, this means that these are the cusps of the opposing arch, actually. And this is wrong. This is an indication of something what we call occlusal intersections. So all of these shiny parts means that both arches are actually inside each other. So, like I told you, this is just an algorithm that is actually just joining or integrating a point A and point B from the upper arch and the lower arch. So, if the patient is excessively occluding, this is how the software would read it, or this is how the software would identify it. So here, it's either the patient was excessively occluding, or either me as a dentist, my hand was not still enough while doing the movement during the bite scanning. So this is too many occlusal intersections. That's why this is the problem here. Too many occlusal intersections, and this is not accepted. Your restoration here will come with incorrect occlusal dimensions. And the cause here, either the patient was excessively occluding or inadequate bite scanning technique, that your hand was not still enough while you're scanning or while you're doing the bite scan. When you view it from the other side, like you see here, very minimal occlusal intersections, like just this very aware while he's occluding, that he's not excessively occluding, and you instruct him to occlude in the right occlusal relation. This is what you could actually reach. Okay, so whenever I have a scan like this, I don't even do a try-in, or I don't even do a temporary restoration as a try-in. I just go for the final restoration because I'm sure of the occlusal dimensions, because I'm sure of my occlusal and my bite scanning. So now I'll just be showing and showcasing two cases that were done with the Helios 700, and then we also clarified that these cases were done with not even the final version of the Helios 700. It was one of the prototypes. So these cases with that accuracy were done with a prototype. So now the one that really better when it comes to the months ago, the temporization procedure was done using the Helios 500. And using the Helios 500, we took a scan over a metal abutment, over an implant case with a metal abutment, directly after the surgery. So this was directly after the implant was placed, just placed the stitches all around, and we took a scan for the metal abutment. And this was taken with the Helios, and this is the PMMA crown, or the in this case, but using the Helios 700. This is the soft tissue profile after we removed the abutment and after we removed the temporary crown. So this is the soft tissue profile that was created because of proper temporization, using proper scanner and a proper designer who designed a proper restoration. This is our scan body in place, and this is the scan using the Helios 700. Okay, so we're actually just documenting the premolar area, but actually here we do have two implants placed, and this scan was taken with the Helios 700. And this video will be showing the scanning procedure, and also will be showing the AI automatic detection of the implant location, which is now an AI tool that is available within our implant workflow. So now with just one click, automatically the implant location was detected. I didn't detect it manually. I also would like to clarify that we do not speed these videos. These videos are on the normal speed. So this is how fast the Helios 700 could operate while scanning a scan body, while you are sticking to the right protocol. And the right protocol is for first scanning the emergence profile in the right way, doing the cut or the implant detection in the right way, and now it's automatically done using the AI, and then placing your scan body in the right way. And then this is how easy you would scan a scan body, even if it's a single case or a full arch case. This is how quick and how easy you could scan it using the Helios 700. Another case, we will, okay, so this case is not done yet. This is the final restoration before placing it. Okay, this is just directly after having it from the lab, and this is after placing it inside the patient's mouth. So this is the result of having a good implantologist placing the implant, and then good temporization. And good temporization depends on a good scanner and a good designer in the first phase, and the final prothesis also depends on a good scanner to capture the correct dimensions, and a good designer to design upon these correct dimensions. Another case, and this is a restorative case, so we'll be going through it quickly. This is just a restorative case that we have done for it, an indirect restoration, also using our Helios 700. We just started, it was an amalgam restoration, just started with the removal of the amalgam restoration. Moving on to CARES endpoints and making sure that the tooth is vital and no root canal treatment will be done. This case was done using the biomimetic protocol. Here we have done the IDS and the RC, and this onlay preparation was scanned using our Helios 700 intraoral scanner, and this is a video showing the scan and the design over the designing software. This is to show the scan itself without the designing restoration based upon. So the thing that I just always say, it's just a complete process. So in order for a designer to do his work perfectly and design a perfect restoration, you need to have an accurate scan and a well-performed scan. And for order for you to have a well-captured scan, you have to have, first of all, of course, a good scanner and a well-produced scanner from a reputable company, and you need to know how to operate using this scanner. So this is this restoration directly before cementing it. This is a direct try-in before cementation. This is here with the cementation, during the cementation protocol, and this is the post-operatively. As you can see, we do have a seamless tooth restoration interface, and this is because the whole protocol is right. We do have an accurate scanner, and we do have a designer who is actually designing, a professional designer who's designing the restoration in a correct way. So that was all for today. Thank you. It's been a pleasure. I hope it was a good session. Yeah, I know it's a quick one. We're just trying to introduce the new scanner, showcase how to perfectly use it, and some cases that we're actually done using it. So this is a quick session. If you do have any questions, of course, it would be my pleasure. I'm available now. And if you do have any further questions in the future, you could actually reach me through the email, my Instagram, my Facebook account, or through any of the sales representatives of Eighteeth. It would be a pleasure to have a discussion with any of you anytime. So if we do have any question, please go ahead.